Congratulations in order tonight for a clinical pharmacist from Dublin. Dr. Kelsey Metts works at the Carl Vinson VA, and she won a national award for her commitment to patient safety. Ramey Cohen's in studio tonight with Dr. Metts' story.
Yes, Frank, it's the highest recognition for employees. Dr. Kelsey Metts and her partner, Dr. David Brown, created a reminder report that screens female veterans. They developed a series of questions for women veterans who are pregnant or may become pregnant. The goal, to make sure they know what medicines are safe to take during pregnancy.
I need to update your pregnancy or contraception status.
One of those reminders is the pregnancy and contraception reminder.
The VA uses reminders to help update before patient visits. Some of the questions they ask: are you pregnant, or are you trying to conceive?
Most of them say no. Are you trying to conceive? Most of them also say no. And then we get into the, are you doing anything to prevent conceiving?
Matt says this question becomes the most educational part for her patients.
So when I tell them, well, hey, you're on 2 or 3 medications that could potentially harm an embryo, they're like, you think we could get me an appointment for maybe some contraception? Sure, absolutely. That's what I'm here for.
Some of those medications include statins.
You absolutely can't take ibuprofen in pregnancy. There are very small exceptions to that rule, but for the general population, that would be something, again, that you would have to avoid in pregnancy.
And blood pressure medications. The side effects a baby could have include:
there have been like prolonged respiratory issues in fetuses or babies that come to term. Sometimes it's just a physical malformation. So some of these drugs, there have been increased incidences of like cleft lip.
Veronica Gould is a veteran and mother of 5. She says she would have benefited from this screening.
It would kind of put me in the know of what needed to be done or what needed to be stopped or what needed to be, other routes I could go.
We have a lot of healthcare providers that could utilize it, so that we're really closing the gaps at all these VAs and updating these pregnancy and contraception status to prevent any harmful medication prescribing.
Frank Metts started the screening in August of 2022. Since then, she called more than 200 veterans and caught 3 undocumented pregnancies.
All right, thanks, Ramey. Dr. Metts says they want VAs across the country to use this screening in the future. That means they would have to work on building a bigger database.